so interesting. We got to visit the olive tree, it's called a restorative village place, which is not on this agenda today, but I would love to talk to you about it. It's how LA County has really built out this campus that's a full continuum of care, and it was pretty spectacular.
Awesome. Oh, I'm so excited to hear about it.
Yeah.
Yeah, and we're trying to get a one-on-one to do some discussions. So I don't know where our staffs are in that, but
I'll check with Michelle right now.
Yeah, if they're listening,
look forward to that.
Please. we
Get us a date. Make us a date.
Good afternoon, everyone. This is the clerk with a courtesy announcement that we are now streaming live on the internet.
Thank you. So we're gonna, we have a few minutes. That's great. We're good.
You still have about 4 minutes.
Great. All right. I'll be right back.
Good afternoon, Dave. Quick mic check.
Hi, Rob. We can hear you. Thanks.
Davey, can you do a mic check?
We can hear you, Sylvia. Thank you.
Perfect. Thank you. I'll turn off video as well. Thank you.
Thanks.
Recording in progress.
Good afternoon, everyone. Give just everybody a minute before I call the meeting to order. Susan, give you a moment to catch your breath. So welcome to our Children's, Families, Seniors Committee meeting for March 24th. And we're going to go ahead and get started. And so I'll begin by calling the roll, asking the clerk to call the roll.
Good afternoon. Vice Chairperson Ellenberg
Here.
and Chairperson Chavez.
Here.
Thank you. You have a quorum.
Thank you so much. Now I'll see if there's any public comment. And this is an opportunity for folks to speak to an item that is not on the agenda, but within the purview of the committee. Seeing none, I'll move on to approving the consent calendar and any changes to the agenda.
I'm happy to move approval and would recommend moving item 4 to consent. It's the extra help usage report.
Great, thank you. And I'm also open to putting item 15, and this is our family-friendly workplace certificate program, on consent, unless you want to hear it.
I don't need to hear it, but I would be happy to make a brief comment about something that I'd like to be considered.
Great. And I'm also going to do something similar with the Neighborhood Safety Unit Services Report, item 16, unless you'd like to keep that off.
Let me take a look at that one as well. Yeah, that's fine.
Great.
And
All
I have
right.
no talking points on 16, just a quick comment on 15.
Excellent. I'll go to you to start us off.
Okay, thank you. And absolutely, Julie and the staff of OWP, thank you for the report. It's really exciting to see that this program continues to move forward. I note the criterion for recognition include local businesses that meet and exceed state and federal employment levels relating to pregnancy, parental leave and accommodations, lactation, and work-family balance. And love that long-term, the program will work to recognize employers who support the improvement of worker health outcomes, productivity, and retention. Would it be possible to consider, especially under the long-term portion of productivity and retention, employers that provide for caregiver returnships and job sharing options? Again, just looking broadly for ways to make sure that we truly are family friendly, which should include reducing barriers for caregivers that want to return to the workforce.
Supervisor, would you like to hear from staff at this time, or is that a question for Supervisor Chavez?
Oh, apologies. That is it's a comment on consent. So let me rephrase that then. Mm-hmm. Thank you. Mm-hmm. I would like to offer that direction that we include consideration for returnships along with the other criteria that you're looking for.
Yeah, that's an excellent idea. Thank you.
Thanks. And thanks, Julie, for helping me reframe it.
Thanks, Julie. On item 15, this is to receive a report from the Public Health Department and Division of Equity and Social Justice relating to family-friendly workplace. I also just want to support what Supervisor Ellenberg just added. And I do want to say a very special thank you to the Office of Women's Policy and Public Health for just diving in and creating the program in the first place. Item 16 this is our probation department relating to neighborhood safety service unit. And I just want to say part of the reason we don't need to hear the report, it's very well done. One request I would make for Chief Garnett, something I would be very interested in getting your feedback on, is whether or not it's possible for us to start to organize the report in a way that's connected, very connected to the outcomes we most want to see. And so, for example, if we're really focused on violence prevention, how do we highlight that, assess that, and then be able to maybe align it a little better? Because one of the reasons I like this program so much is I think it really does give us an opportunity to build meaningful relationships with the community, and then be able to, working with the community, develop new programming. But the loop I want to complete there is, to what end? And then how do we measure that success? Because one of the things we have to ask ourselves is this an island? Or is it something we'd like to build out? And I don't know the answer to that, but I think if we could restructure it, it might help us assess that.
We will definitely work on that. We'll work with our research and grants unit to work the research and development unit.
Yeah, that's great. I forgot you have all those smarty pants over there. That is
Yes, we do.
perfect. Excellent. Supervisor Ellenberg, are you comfortable with that direction?
Yes, I am.
Great. And if you could make the motion, we'll act on 4, 15, and 16
So
with
moved.
those comments. All right. And second by me. Thank you very much. Thanks all. We're going to move on to item 5.
We need to do a vote.
Vote. Since there's 2 of us, I always think the vote's so funny, but go ahead.
Vice Chairperson Ellenberg
Yes.
and Chairperson Chavez.
Yes.
Thank you.
Absolutely. Thank you. Thanks for catching
Rob
that.
Coelho, Assistant County Counsel, quick comment. I'm assuming there was no public comment on the consent items?
There was not. Thank you for
Perfect.
asking. All right. So we're going to go then to item 5. And this is schooling services. And I'm going to hand it over to Sherry and her team to present.
Great. Good afternoon, Chair Chavez and Supervisor Ellenberg, Sherry Terrell, Director with our Behavioral Health Services Department. Today we have Zelia Friacosta and Catherine Asperis, who will be presenting the report on schooling services.
Hi, good afternoon, Chairperson Chavez and Vice Chairperson Ellenberg. I'm Catherine Spears. I'm the Program Manager for Schooling Services, and we provided a report providing Q2 updates for the fiscal year. We do have a brief presentation, or we can move on to straight discussion and questions. The presentation includes just the summary of our report.
Supervisor Ellenberg, do you have a preference?
Well, I've read it and had some pre-conversation, so I'm comfortable moving just to questions. I don't know if you'd like the public to have the benefit of the presentation.
That's such a good question. I think if Catherine, if you could maybe just hit the highlights
Sure.
for the public, and then Supervisor Ellenberg will go right to you.
Okay, great. Next slide, please. And the next slide. So this is our, for Q2 and cumulatively for the fiscal year, we have served in our Family Engagement SLS Coordinator Program. We've served over 2,700 students and families. This provides the demographics of the majority served. We also are capturing information around insurance type, and 64% of the students that did respond to their insurance had public insurance. We also are collecting information about the top reasons for referral. 50% of the referrals were related to emotional well-being, followed by 11% regarding school achievement. In Q1 and 2, we've had over 184 family engagement activities and served over 16,347 students and families attending. We've had 30 family engagement workshops, and those tend to be workshop series where we're increasing knowledge, increasing skills. We've had over 1,200 attendees. Next slide, please. And just to highlight, we provided a caregiver satisfaction questionnaire at the end of Q2. These are our response rates for the services that we've provided through the SLS coordinator. 77% of our families felt that they learned about available resources and services for their family. 78% have received the tools they needed to improve their child's health and well-being. We saw that 75% received tools to help improve the child's academic success. 91% of students felt they were more comfortable and welcomed at school, and 71% of parents felt more connected to the school community. We have seen some changes into the response rates or the responses of this survey. So we're definitely working with our SLS coordinators on how we can best improve our service delivery. Next slide. This provides updates regarding the school-based behavioral health programs and the MRSS program, our crisis program. As we shared back in August, we did increase our contracts by 10%. So we are seeing here the number of students and admitted to the programs, also the increase in services that we are providing through the various programs. We did see an increase in MRSS calls. And we expect to be utilizing the full 10% budget that was allocated to MRSS. We are seeing that the PI, the school-based behavioral health program, although we are seeing students, we still are projected to be underutilized due to the workforce shortage, but we are still working with the providers to ensure that we retain and recruit for staff to fill in those vacancies. Next slide, please. Next slide. So we've had our MHSSA grant in fruition, and we've had 4 wellness centers established. They did a soft opening last winter, and this is at High Middle at Cupertino, Britton Middle at Morgan Hill, Andrew Hill High School, and Oak Grove High School at Eastside Union. The wellness centers has served over 1,000 students, and then we are collecting information regarding their indication if they would return, and 83% said they would return to the wellness center. Next slide, please. As we are expanding schooling services, this is both the schooling services family engagement program, the role of the SLS coordinator, as well as the school-based behavioral health programs. We've outreached to 7 school districts. 2 school districts have executed a contract with behavioral health, and 1 school district has already employed their SLS coordinator. We have 4 school districts pending, and 1 school district did decline the resource this year, but we are looking at revisiting and reconnecting with the school district for next year's services. For our school-based behavioral health program, 5 additional school districts were added to provide PI and SLS services. We have 3 school districts fully implemented. 1 additional school district will be implemented starting in April, and then 1 school district did decline this resource. We'll reach out to them again to see if they are open or interested in the service next year. We are outreaching to the 10 remaining school districts, and we have in progress of service agreements with 2 of the school districts. So we will be able to fully start those school districts with the SLS coordinator for the FY23 school year. School-based behavioral health programs, we are identifying ways in which we can expand the PI program to additional schools, and we will look at expanding the PI program to more school districts in FY23. Next slide, please. So in addressing chronic absenteeism, as we shared that we are expanding SLS and the SLS coordinator role to new school districts, we have begun expanding SLS behavioral health programs. We have worked on increasing capacity through our MRSS, and they have been utilizing the additional capacity. We have our continued participation in CareCore through a behavioral health mental health program specialist. She attends CareCore every month and is able to link the students to services, as well as to county resources and school resources, as well as to the SLS coordinator. We've identified and implemented the fundamental trainings and have reshared the information to school districts in preparation of next year's planning as well. And the County Office of Education developed a work plan that has been shared previously that is still being utilized as a work plan that we are moving forward with. The next slide. So the Student Behavioral Health Incentive Program, that's the SBHIP. This is to increase mental health services through the work group and participation of managed care plans. So the first box identifies the criteria that we utilize to select the local educational agencies. This included free and reduced lunch price meals over 36%, English language learners over 20%, chronic absenteeism over 8%, suspension rates of over 2.5%, and at least one of the schools in the school district had is considered high risk as we looked at the high risk factors. The selection process is on its way, and we are working with County Office of Ed and our managed care plans to begin implementing the needs assessment. The targeted interventions that were identified through DHCS are listed there. We are still reviewing these targeted interventions, and the plan is to select 2 to 4 interventions in which managed care plans would be reimbursing for. Next slide, please. And that concludes the presentation. I can take any questions or comments.
You're on mute, Supervisor Chavez.
Thank you very much. I was first going to see if there was anybody from the public who wanted to speak on this item. I see one hand, so I'll take the public speakers and then I'll come to you, Supervisor.
How long would you like to give the speaker, Madam Chair?
2 minutes. Thank you.
All right, one moment, please, while we get the timer up. Next speaker is Laura Clendaniel. I'm unmuting you. Please accept the unmute. You will have 2 minutes to speak. The timer will start when you begin speaking.
Hi, my name is Laura Clendaniel. I'm the Director of Operations with Healthier Kids Foundation. Just wanted to say thank you to Behavioral Health and Schooling Services. This year, Healthier Kids Foundation has been able to provide emotional wellness checks among fifth graders, and we've nearly reached 2,500 students thus far. And are seeing pretty staggering referral rates. We are grateful for the schooling services coordinators in the districts we've been working with who help connect those students to care very quickly. Grateful to all of you. Thank you for your support and your time.
And that concludes our request to speak.
Thank you. Supervisor Ellenberg?
You're muted, Supervisor.
Thank you, Dave. And thank you to staff for the report. I was struck by the fact that among the 4 health screenings, mental health screenings had the highest need for follow-up support, showing 53% of the students in the pilot. What are some of the plans for expansion of mental health screening to other districts?
So currently with our contract with Healthier Kids Foundation, we are renewing our contract for next year to continue the service at Franklin McKinley School District. And then also looking at how we can best fit the universal screening in our SLS programs and through other initiatives that is coming into play. Zelia, I don't know if you want to include any additional information as what we are looking at to explore.
No, I think that's good, Catherine. We really are looking at our existing resources with our contracted providers to see how we can utilize them in this universal mental health screening approach at the school sites that they're in, because it fits quite nicely with the prevention and early intervention services that they're already providing.
Yeah, it does, and I appreciate that you're looking at it. Certainly, I think that this is really an important strategy to keep in the mix as we look toward a system of accessible supports for kids and youth. I'd like to see administration, in partnership with the County Office of Ed, develop a model and recommendations regarding how school-based screenings, SLS coordinators, on-campus wellness centers, and the Alcove integrated centers all fit together for a layered approach to mental wellness. I know this has been part of the discussion on the wellness center expansion from the February referral that Supervisor Chavez and I partnered on, and I view this as components that should really be addressed in parallel.
Absolutely. Thank you for that comment.
Thank you. And what is the status, Sherry, of the overall planning with school districts and contracted providers for next year? You did give us sort of the list of who's in, who's out, and I'm curious to know which school districts have expressed interest thus far. I'm not certain it's appropriate to share right now if we're working on contracts. But I'm concerned about the crisis response services based on our last discussion at CFSC with school districts. And I'm wondering if there are going to be any plans to maintain or modify the expanded contracts that were approved last August. And can you share thoughts there, and also, Sherry, what you're seeing in terms of utilization that might guide where additional support should be targeted?
Sure. I guess I'll go ahead and turn that over to Zelia, then I'm happy to jump in.
Thank you.
Sherry. Yeah, so for next year, we are planning to keep the 10% increase that we provided all of our PI, SLS, and also our mobile stabilization response services providers. So that will continue. Next year, we really want to be sure that the supports are in place, and we have seen an increase in the demand for the mobile stabilization and response services to children. So definitely that program will keep the 10%. And also we are adding additional dollars through other venues. We have recently received a grant that will also support the increase of capacity to the MRSS program. So also in the planning and will take place as well. As far as the PEI and SLS providers, the utilization for this year, it's projected to be about 64% of the increase that we gave them for this fiscal year. And it's mostly related to the workforce shortage.
Right. So part of our work plan, I know, has to be thinking very strategically and specifically about strategies. What are our strategies to help build that workforce pipeline? Are we partnering formally with community colleges or universities? Are we doing some sort of additional recruitment? And I know we have a sensitive issue here with our providers also looking for that same workforce. So perhaps we're doing this all together, but how are we really directly working to build that pipeline?
So yes, we are, to your point, Supervisor Ellenberg, working collaboratively with our Behavioral Health Contractors Association. During the behavioral health workshop, they put forward several suggested strategies. And so our continued partnership and effort related to workforce is going to continue. We're partnering on several items. One, the opportunity to ensure that we are able to offer tuition reimbursement and loan repayment programs to our clinical providers in both community-based organizations and county-operated programs. And second, one of the strategies that we will be working on, as you've noted, is reaching out to our local universities, as well as online programs that are that students who live in the local area but may be engaged with an external university but are studying social work or clinical areas of study. We're going to be working on partnerships with our Behavioral Health Contractors Association to develop those relationships and really focus on that career pipeline that you've stated.
That's great. That makes a lot of sense. And I heard you address really the two avenues of concern. One is that there aren't people in the pipeline that are choosing this profession that we have to make sure is robust. And then second, if they are out there, what do we need to do to entice them to work in our county, whether it's directly for the county or for one of our partner agencies? And the comments about tuition reimbursement and anything else we can do. Not tuition, yes, tuition or loan reimbursement, I really appreciate. So thank you. Just coming back for a moment to the utilization, and I understand the limitation. What other metrics of success are we using? I know we can talk about utilization in terms of capacity. What else are we looking at to determine whether our interventions and our screenings and our connections to services are successful, and what is success? So therefore, what does success look like? Is it on an individual level, a systems level, a school district level?
Well, each of our prevention and early intervention SLS programs have a logic model that identifies outcomes that we are reviewing in terms of looking at the effectiveness of the program. So we look at the CANS data, and that's something that we are building out as part of our SLS data and evaluation for FY23. And then we also look at consumer perception surveys that's administered twice a year as a state mandate. We have also are doing focus groups more so with our SLS coordinators to capture information about how the success of that program, what areas to improve, and developing also quality improvements, opportunities that we can improve our service delivery.
And do we have an element of surveying families or kids?
Yes, so that's surveying of the SLS coordinators survey students and families twice a year at the end of Q2 and then also the end of the academic year. And then the consumer perception survey that's mandated by the state is also administered to our clinical behavioral health programs. That's done in spring and fall. So we should be having one upcoming this spring.
Great, thank you. And I'll just finish with one additional comment and some direction, please. I so appreciate the range of issues that's addressed in the report, including planning with partners on the new state resources. And I'm certain that these are areas that are of interest to our full board. I made sort of passing note to this in the January referral, in the conversation around the January referral with Supervisor Lee to declare mental health and substance use disorder a public health crisis. But I want to more formally say that I'd like to see regular coordinated reports to the Board of Supervisors on priority issues through something like the way we do the jail sessions, the jail study sessions, rather than kind of a spread of reports across several policy committees. I'd really be interested in seeing staff bringing recommendations in the April response on how to restructure those recurring reports that would help our whole board continue to see the big full picture as opposed to just the individual programs in our systems of care. I certainly hope as well that would ease some of the meeting and reporting burden on staff and also help us accelerate progress on those priorities. That would be my motion with whatever Supervisor Chavez adds with her comments, if that's acceptable.
Yeah, Susan, I think that's a great idea. I think one of the challenges, Sherry, that you have with all of us is that, well, there are many with the board, but I think one of them is that we are also hyper interested in very particular issues. And I think what Supervisor Allenberg is raising is such a good idea, because in some respects, the better understanding the whole and how all of these programs are layered on each other is really helpful to us. And I think part of the reason we like these particular kind of reports is that where there's a high level of interest, you can kind of focus down. But I think it puts you in a situation of us asking a lot of questions that really require the overall programs to be reconnected for us. And so I think you raise a really good point. And the other thing too, Sherry, I'd love you to think about this, is that the thing I love so much about the committee process is that it is the best opportunity you have to educate a couple of members of the board deeply in the work that you're doing. And so the other thing I would think about is whether or not it makes some sense to highlight a couple of topics. And Supervisor Allenberg, this is something you and I could do too, as we, is to agendize the work plan for the next year, so we can talk about it more robustly. Because of the Brown Act, we can do a little bit of planning together, but it makes it very difficult for us to do that. But what we may want to do is just schedule for the next meeting, what are the key areas we want to dive into over the next year, so that we're really able to hone in and then be able to support the staff's efforts in giving us reports that are reflective of the outcomes that we're looking for.
I like that, and I think also, that balance, part of the advantage of having us all together also is that we're not, because of the Brown Act, we're not creating referrals that are redundant or that overlap and integrate. And I might be worried about something that's actually being very well addressed in a different committee. And if I knew about it, right, my anxiety would be reduced there. So yeah, I think finding that balance between keeping us all apprised across our system of care is critical, while giving us a little bit of space for the things that we're most interested in to really get very wonky about.
Yeah, and we can give that some thought as part of a public meeting. So thank you. Staff, I have a few questions that are going to appear to be all over the map, but they're related to the report. So first of all, let me just say thank you for the report. I also wanted to just acknowledge that I thought that what I appreciated about this report is that you were able to quantify the number of folks that were helping children, and that was very helpful, because I think one question we're going to have to really start to think more judiciously about is, as we're expanding programs, how are we prioritizing the resources, especially the general fund component of our resources, relative to the outcomes that we're getting. So this was very helpful for me to get me thinking about that. So let me start with some some big picture issues. And one of them is just to touch on what Supervisor Ellenberg said about the best way to measure the impact we're having. And as I was looking at the utilization tables, it got me very interested in a couple of school districts in particular that are really utilizing a lot of resources, which I think is great. So I want them to keep doing that. But it does seem to me that this is one of the few opportunities we may have to be able to do a year-over-year comparison, both in terms of access, but also achievement, and looking at absenteeism rates, educational attainment rates, and the reason I'm looking at absentee in particular is that I do think that's one of the most overt signs that we have of student engagement, right, in terms of family capacity to make sure that children are at school. So what I would like to see as you take a deep dive is to take a look at the school districts that have really been utilizing our services for some period of time and hone in on some of those, because I think it would also help us understand something, which I'd be really interested in getting any of your feedback on, which is what are the 4 or 5 things that we can most quantify. I'm looking at absenteeism, not just because I see it as such a significant challenge, but I also see it as such a significant indicator and one that is objective and not subjective. So that's one that I would be looking at. Educational attainment, obviously, but I don't know if you've already been thinking about other indicators that the programming we're doing is having an impact.
I think some of the indicators across, we look at the cross school districts is graduation rates, included more so on the high school end, but that's more of a long-term outcomes. Some of our short-term outcomes that I have shared before is looking at the improvement of students in of clinical treatment and their improvement in their outcomes there. And then moderate term outcomes is looking at primarily where we can see some community improvements. If we're looking at systematically how SLS and PI programs have also uplifted the community. So we can look at some of the community aspects, but definitely education attainment, absenteeism, graduation rates have been also something that we can review.
I think, Catherine, the challenge with it puts us in a position of looking at outputs and inputs instead of outcomes. So I want to bring us back to the outcomes component as much as we can do that. And I think your point that's very, very smart that I just want to lift up is I think we have to take a look at whether or not it's possible for us to, working with the schools, follow a subset of children. And in particular, one of the things that we've observed is that when we look at graduation rates for high school, what we're often missing is the number of kids that have dropped out before they get to that graduation rate. So for example, one thing that I think we could be looking at is middle school to high school transition. So how many children from elementary school go to middle school, how many middle school children go to high school, because that is really going to help us hone in on whether or not we're able to find that whether or not we're having an impact or other programs are having an impact. And the other thing that's good about that is we're not looking at 4-year increments. We're able to look at much shorter timeframes because, to determine the whether or not a child's been able to move up a grade and be able to be in that class even for a few months. So I would really want us to look at that. And I also think that that there was something else that you said I thought was really very powerful about actually working on how children do in accessing services. So there are kind of 2 big issues there for me. One is, how do we take the work that's being done by the Healthier Kids Foundation, as an example, those screenings, making sure that if we're screening X number of children, Y number of children are actually getting services. And again, I know that's an input and an output, but that is the that's sort of I mean, those are all things that we can hang a hat on to say that when we see these kinds of utilization rates, we see these kinds of outcomes. And right now, I don't feel like we've knitted those together quite. But I'm very interested in that. I think Supervisor Ellenberg is right that we've got to be able to figure that out. And part of the reason for that, let me just go back to the utilization, where we have significant utilization. I think it just gives us an opportunity to take such a deeper dive into what paths actually have success. And we've got some good, and we've got some partners we've been working with for a number of years now. So I think that's very exciting. One other thing I'm interested in, are we expanding the Healthier Kids program and screening program?
For next year, we are just renewing the contract, and it would be with Franklin McKinley School District. And we've screened them this year, the 5th graders. It would be the same.
And may I ask why we're not expanding that program, especially, and I want to go back to what Supervisor Ellenberg just said about their ability to get the families to do the follow-up on the referral. I've seen them do that with dentistry too, and I'm very interested in that on the mental health side. So is there a reason we're not expanding their program? And then again, just not to put too fine a point on it, but be able to test the efficacy they have in terms of getting that child to that follow-up appointment?
Yeah, I would defer to Zelia or to Sherry regarding that.
Yeah, so this relates to the question that Supervisor Ellenberg asked earlier. So yes, we're renewing their contract with the same funds that were in this year, because we're also exploring how we can use our existing services and providers to be able to provide that service, the mental health screening at the school sites that they're in. That actually provides an additional level of support, because it provides the continuity of care for those children who are screened and are screened to need services. They can then be connected to the service provider that they're being screened with, if that makes sense.
So it does and it doesn't. So here's the question. The reason I'm going to press on this a little bit and ask that this be something that we really consider. We have a program that we know works with a relatively high efficacy rate to getting children who are screened to the medical provider, which in my mind is one of the reasons I think we ought to measure how effective we are in both identifying, getting the utilization, and then determining how the utilization has impact. And this is a relatively low cost program that I think we've seen some very promising rates of return already. And if what you're saying is that you're looking at a finite pool of money and that you're taking that finite pool and you're making some other decisions with it, which is what I think I hear you saying, Zelia, then I understand that. But I guess what I would be pressing on is if you could help us understand, or I don't want to speak for Supervisor Ellenberg, but help me understand the strategy that's being employed, because right now I think, well, anyway, period.
So, I mean, it really is also related to some of the things that are going to be changing with the CalAIM initiatives and how our providers would be able to actually be covered and reimbursed to provide those services as well.
So got it. And Zelia, let me just say what I think the problem with that is right now. And that is that we expect that CalAIM will kick in on the behavioral health front in 2023. And so what concerns me is we're in 2022, our fiscal year is going to be 2022, 2023. And what I would really like to make sure of is that the programs that we're investing in that we think are working are robustly funded. I'd love it if they all transition over and we're really able to use CalAIM. I'm still not a believer. I'm hoping that we're all right about that. And one of my concerns is that my understanding relative to CalAIM is that we still don't know exactly on the mental health and behavioral health front exactly what they're going to be willing to cover that they're not covering today under Medi-Cal. So I'm going to reinforce that what I'm hoping that we're going to do is take a look at that. And it's something too, I assume I can also take some action on, but I'm nervous about that transition, and you guys are more hopeful, which I appreciate. I appreciate hope. All right. Just a couple of other questions. Sherry, where are we on the placement of Alcove, the second location?
We are currently working and are constituting research with FAF to begin to look for another San Jose site. So currently we are working on the development of a drop-in center at the 725 East Santa Clara site that would still provide some of the services that Alcove San Jose was providing while concurrently looking for an ideal site in San Jose. So that's where we are currently.
And is the hang up the ideal site that they have to walk across a little path to get medical services?
Well, in order for the Alcove's program to be fully implemented to fidelity, all of the services must be under the same roof, in the same program, in the same suite. And so that is one of the challenges with the current location at the 725 East Santa Clara site. And I think there just is a really important interest in finding a site in San Jose that could fully operate and provide the full Alcove program. And so that's what we're really seeking to do.
So Sherry, I just want to say out loud how incredibly concerned I am that the Alcove model is so rigid. And one of the reasons I'm concerned about it is that I don't believe that Alcove's model will be attainable for many, many parts of the state. We are much better resourced than most places. And I am really concerned about the rigidity and the under one roof. I would understand that if they were even crossing East Santa Clara Street, but it is a parking lot. And so I'm just going to say that out loud because I'm kind of stunned that we're still there. My request would be that we consider the placement of Alcove in the VASC. And the reason I'm interested in the VASC is that I think it's one of the best ways we have to do a better job of integrating services there, both for people who speak Vietnamese, but also Spanish. And my nervousness about not moving in a place that we've already got a really, a great service model and a robust opportunity is that that the program dies on the vine for the lower income part of the community that's being served by this program. I know none of us want that, but that's my fear, is that it'll just be kind of chipped away. So if we could get something off agenda, in fact, Sherry, I don't want to have you do another report. I know you all are working on this, but what I would just ask is if in the next week or so, if I could just get a phone call from somebody saying, we figured out how to do it on East Santa Clara Street, which is very close to where we are now, which will serve a lot of really children. It's in a very diverse area of town, or we're going to be at the VASC, because anything in between that is going to equate to too much time going by. And I think, frankly, the VASC was designed with the idea that we were going to have robust activities for teens as well. And that's why that top floor is so gorgeous, and why those conference rooms are so big, and why there's couches and all the rest of it. So that would be great.
Certainly, we can reach out to your office within a week.
That's wonderful. And then I just wanted to tell you, and I wonder if Chief Garnett, if you're still with us, and Supervisor Ellenberg, I wanted to share something with you. So today we did a tour of the reentry center that we're hoping to have a no entry center someday. And we took most of the police chiefs in the county did a walkthrough of the sobering center, or the recovery station. I always forget the name of it. And there was a lot of interest and a lot of excitement around it, a lot of pressing on us about, some changes people wanted to see, but it was all good. But one of the chiefs asked this question. They said, where is the sobering center, the alternative for youth? Where's the program that looks like this for kids? And especially those who have some criminogenic activity, whether they're maybe close to being in a gang or any of that. And I wanted to share that with you because they were so inspired by what they saw. They wanted to know, where could they take kids other than juvenile hall that have a high need? And I know, Chief Garnett, this is something you've been thinking about, because I've listened to you thinking about it, but I just wanted you to know that I thought it was amazing that the chiefs were interested in that as an alternative, and wanted to share that with you because I kind of got excited about it. And I don't know, Chief Garnett, if you want to share some thoughts.
No, I'm also excited that the police chiefs think that, and because I think the sobering center is a great alternative. So yeah, we definitely can start looking at things. We already are because we have the secure track. So we're looking at, are already looking at robust reentry. But yeah, we'll certainly work with Javier. And
yeah, give it a thought. Could be very cool. Excellent. And Susan, I thought you would in particular like that. So good. Well, thank you. And thanks for the report. And what I'd like to do is have Supervisor Ellenberg, we'll make a motion with the recommendations you made. I am going to add in the expansion of the screening services for healthier kids as a request directly to staff. And then also the ALCO, just keeping me in the loop, and let's make sure we get that done before we don't have a place for it. And then to have ask staff to give us feedback about, what are the markers we should be looking for success, with an emphasis on the districts that we're already working with, not because I want to leave others out, but just because I think we've had enough kids come through there that we could actually look at absenteeism. And the one thing I'll just say is I don't feel like this addresses chronic absenteeism even close. Like I think we're using it as an indicator. So I still have concerns that we're missing a very important opportunity to intervene with families. And I will give some thought. I don't have anything helpful today, except just to say it still didn't feel like it met the need that I was originally interested in. So I'll continue to work on that. All right, Supervisor Ellenberg, you want to make that in the form of a motion?
So moved.
And I will second that.
Are you ready for a vote, Madam Chair?
Oh, yes. Thanks, Dave.
Vice Chairperson Ellenberg?
Yes.
And Chairperson Chavez?
Yes.
Thank you.
Thank you. Thanks so much, you guys. Good report. All right, item 6, mandated reporting in partnership with school reports.
Hi, good afternoon, Chairperson Chavez and Vice Chair Ellenberg, Daniel Little, Director of Department of Family and Children's Services. I think we also have Joanne Vars from the Santa Clara County Office of Education to answer questions. So a really brief PowerPoint I'll share. So over the last several months, DFCS in collaboration with the Santa Clara County Office of Education and the Child's Advocacy Center developed an FAQ document. The FAQ was developed part and due to the questions that DFCS was receiving and Santa Clara County Office of Education was receiving from the school districts regarding mandated reporters. And I think also a connection of their role with the Child Advocacy Center. We also incorporated some of the feedback we heard from the special session back in November. Along with that, based on the recommendation of Joanne and her staff, we developed a visual flowchart to let mandated reporters kind of know the process that a call is going to go through when they're making their call. We had a session with Joanne facilitating with liaisons from the school districts back in January, where we provided the initial FAQ and answered questions. And the next session scheduled for April. So we have committed to meeting with Joanne and her staff and the liaisons from the school districts quarterly. We've also answered individual questions from the schools that have come up on specific case level discussions. We're also excited that I've connected with James Gibbons Shapiro, and we're going to add this FAQ and that flowchart as a kind of an appendix to the upcoming version of the law enforcement child abuse protocol. So it'll be memorialized in that official document. With that, that was kind of the end of the official information, but I'll let Joanne, if there's any additional information that you guys would need or available for questions.
Joanne, did you want to add anything?
I'm happy to speak to it, but it feels like it would be redundant of what Daniel just said. So it is wonderful having a partner. There were a lot of questions, as Supervisor Chavez and Ellenberg probably know. Each school district does have someone who is responsible for being the foster youth liaison, and as questions, that job specifically provides educational services to foster youth. But because of that role, many people come to these liaisons when there are questions. And so really appreciate Daniel and his team stepping in and helping address some of the questions that are kind of outside of the realm of services, and appreciate the ongoing commitment to coming to these community of practice network meetings. It's an honor for me to be able to facilitate those meetings, and appreciate Daniel's commitment by his office to attend these meetings quarterly so that liaisons have the opportunity to ask questions and get updates from his office directly. So thank you for that collaboration.
Supervisor Ellenberg, did you have any questions on this item?
I don't. I appreciate the report. Thanks, Dan, and thanks, Dr. Bars.
If there are any speakers on this item, this would be the time to raise your hand. I see no speakers on this item, so I'll come back and close the public hearing component of this and just make an observation. You know, one thing I would really like to get, Dr. Bars, I'd love to get the some mechanism for training verification from the schools. Because I think part of the challenge is that it seems like no matter how often we talk to the liaisons, that we still have teachers giving us feedback. They don't know what to do. They're not sure what their role is. And my observation is that that may have more to do with how the trainings happen at the school level. So if there was a way to annually do a check-in that says this is how many people we trained and this is when we trained them, and these are the schools that got trained, I think that would be very helpful to us being able to respond to the inquiries we get from schools, and we get them. And, you know, because I think that would also help us hone in on who needs more support with training.
Thank you for that recommendation. I know schools do have that because it is a compliance an indicator that must be reported, because all school district employees must complete mandated reporter training within a certain number of days of the first day of school. So that is reported to the California Department of Education as an HR standard.
Oh, that's great. And so we can access it on their database.
I will find out how that's reported,
Okay.
but I do know that it is a reportable compliance issue that every school employee either has to have it within 60 days, X number of days.
No, I remember that too.
Of school starting or when their employment begins. But it is.
And is it
tracked.
annual? And it's annual.
It is annual, yes, ma'am.
Yeah, I have to say I'm stunned at how many teachers I talk to that don't even remember having the training. That's helpful. If you could help us understand how to track that, because I'd love to be able to be very transparent about where we're getting the complaints, you know, and be able to match them up would be great. Thank you so much.
No worries. And this is one of the challenges between a compliance item and something that is presented in an instructional pedagogy that helps you remember, because we know, you know, to be introduced to something new, you need to have contact 8 times before you make it your own. If it's, you know, only experience it one time, you may not know, but people who have been in the business for a minute, I could recite back to you the mandated reporter training.
Yeah, that's just good feedback. Thank you so much. All right, there's no action on this item. It's a report. So I appreciate both of you working on that, and we'll make sure. I'm going to ask Dan, if you wouldn't mind, with a cover letter, sending this over to the City of San Jose. I forgot what committee it is, but I know Sylvia Arenas was very interested in this. So thank you very much for all your good work on that. Item 7 is our family finding report. And Dan, did you want to say a little bit about this?
Yeah, and I can cover it briefly. I do have a real quick presentation if you want me to go over that.
Thank you.
I also have Damian Wrights, our assistant director, is online in case there's questions that come up. Let me share this. Okay, so to start out with, the DFCS has created some specific family finding teams, which is newer. We've had this in the past, but now kind of re-engaging. So we have staff that do the traditional family finding, which is, you know, for the front end for new families coming in, as well as children that we have working with us. With those units, we have 2 social workers and then a supervisor. They've served 41 youth and have located 107 relatives. And you can see the list of connections. I think, really amazing is through that work, we're able to actually reconnect children with family that maybe parents that maybe previously had their rights terminated to kind of re-engage that connection. So really exciting. The second piece of that is what we call intensive permanency services. So it has a different title because it's from a different agency, a little bit different model, but it's in essence the same thing. These are for the children that we have that would have been kind of historically stuck in our system. Maybe children and youth that had really significant trauma histories and in the past would have been looked at as children that are going to be with us, until they age out, and we don't want to see that. So intensive permanency services has specific social workers that work just on the permanency piece with them to locate family, and then work with a primary case carrying social worker. So with that, we've served 8 youth, 30 relatives located, 24 relatives and non-related kin or friends established. And again, 10 mothers and fathers reconnected that in the past would have been lost. So a lot of amazing work being done by our social workers currently. The next phase is the actual family seeing. So this is the work with Kevin Campbell. So he developed the original family finding model. So family seeing is really his evolution of the model, which is just to notice families how they are and make sure that everything we do has a family at the center of the decision making. What I'm excited about is in our agency, we've been able to share this with probation, with behavioral health, with some of our other community partners who have attended the initial boot camps. And within DFCS, we've made 3 commitments to this. One of them is that, and it was on, I think, the first slide, safety is temporary without healing. So the idea that when we're talking about safety, that if we don't address the healing piece with the individual and with the family member, that's only temporary. Family engagement is non-negotiable. That's something that DFCS is going to do. It's a non-negotiable piece that we were always going to be looking at how we can engage family. And that children have the best long-term health outcomes if they can remain connected with their families. So we're not just rolling out a process and procedure. It really is these agreements that we're making that we're then sharing with our partners. So with the boot camp, like I said, the initial boot camp was January of 2022. We just did, and we call it boot camp versus a training because it really is supposed to be experiential and not just a rehashing of information. Second boot camp was in March. We had staff provide feedback on how they feel like this would be more impactful. Some of the material, some of the race equity pieces that we're going to be including. So we are going to be continually revising that curriculum to make sure we're meeting the needs of both our staff as well as our community. We're going to be providing this to our legal stakeholders. We just provided an abbreviated training today to the Dependency Wellness Court participants. So just very excited to see that it's not just a DFCS, but it really is a system-wide recognition of the importance of the connection with family. And with that, I'll pause and answer any questions that you may have.
Excellent. Let me see if there's anybody from the public who would like to speak on this item. Seeing none, I'll come back and see if Supervisor Ellenberg, do you have any comments on this item? Just one, Dan, just really struck by, first of all, thank you for the report. I think the work is really incredible. You were really emphatic about family engagement being non-negotiable, which I suspect in the vast majority of cases absolutely makes sense. But there must be some circumstances in which a child would risk truly being harmed through that engagement. So when you say non-negotiable, do you really mean non-negotiable?
Yeah, thanks, Supervisor Ellenberg. And that's a good question. So there are going to be situations when we talk about where a child can reside that maybe having there may be a home that we can't approve for one reason or another. And there could be situations when the relationship is harmful, and that's when we need to go back to that healing component. I think regardless of maybe the role that family member is going to play within the child, having them still having some kind of a connection, and safety needs to be primary. The research that Kevin and Family Finding has done over the last 20 years really identifies the large number of family members that are typically available to all of us. So some of the work may be to identify those that are going to be a positive, supportive relationship. So when I say family engagement is non-negotiable, it's not that, you know, we're going to kind of throw safety to the side. It really is that we're going to continue through the life of working with a family to continue to find and encourage and nurture those natural supports and circle of supports for those children and those families.
Supervisor Ellenberg, does that address your thoughts?
Yeah, it does. It's painful and it's fascinating. Thanks, Dan.
And Dan, I just wanted to say I am so excited by this body of work. I know I've been just really aggressive about this for years, and I think this has just been an amazing odyssey, and I'm hopeful that the more you understand how all of this works really to support these kids, that you're going to help us think about this for other departments as well in terms of these reconnections. I was particularly struck by the number of children who get reacquainted with family members that they may have been isolated from for so long. So these numbers are really incredible. I recognize that we've seen a drop in relatives and in non-relative extended families. And I think you're probably right that it's due to COVID. I'll look forward to understanding that better as we move forward. And thank you so much for making sure that people are getting trained. So thanks. I don't think we need to take any action, except I'll look forward to learning more as you keep going forward. Thank you.
Welcome.
Really good work. We're going to move to item 8, and this is the CAN Center. This is an annual report that comes to the board, and I'm very excited, Dan. I think we're going to hear from you and Damien.
Yeah, thank you, Supervisor. Actually, I'm going to do a quick introduction and then turn it over to Damien and Tracy to provide the actual information. So let me pull up the presentation. While I'm doing this, I do want to give a little bit of kudos and share some of the work that Tracy Bowers has been doing, our CAN Center manager. Tracy and a group of our CQI staff were invited to present at the statewide CQI conference yesterday around the work that she's been leading at the CAN Center on data.
Wow.
And received tremendous kudos from the participants about both the presentation, but as well as the work that she's been doing. So I'm very happy to turn this over to Damien and Tracy.
Thank you, Dan. Good afternoon, Chairperson Chavez and Vice Chair Ellenberg. You can actually progress to the next slide, Dan. So this is a pretty short presentation directly responding to information requested. There were 27,211 suspected child abuse reports in calendar year 2021. 87.7% of callers were mandated reporters, which is the most common reporting source. Of that 87.7, counselor therapists 21.98%, law enforcement 21.57%. 95% of callers chose the English language queue, as there's an English and another queue that they can go through. 7.5% opted for voicemail, 620 joint response calls, and 1729 written police reports. There were 533 abandoned calls, 2.18% of callers, which is similar to a prior period, so there isn't much differentiation there. And then 1 minute, 37-second average wait time before abandonment. And Tracy, I don't know if you want to add to this slide.
I'm out here. I just can't turn on my video. We do have other language cues. You can opt for Spanish calls, and you can also opt for Vietnamese speaking calls as well. CAN Center screeners were pretty busy last year in spite of COVID. So I'm just really happy about the way that we can now collect the information and the data and our dashboard. Thank you, Damien.
Thank you for that, Tracy. We'll advance to the next slide. We actually have some support from Assistant Director Wendy Kinnear and Rocio Abundis, one of our program manager threes, that can speak to neighbor, but basically that is a supportive services program to connect callers or that need resources to community organizations, or actually one community organization, which is AACSA. We also do continuous quality improvement. What that is really making sure that, like Tracy stated, the data that we're seeing, we use that to look at trends and opportunities to get better. We also use that in data analysis supervision, making sure, and Tracy does a really good job at this, making sure there's constant conversation about what are we doing, how are we doing, what are we seeing, and how do we connect that to doing better service. Also looking at the CANS dashboard, which is actually available, looking at solution work groups, which I actually let Tracy speak to, and then our internal and external engagement, which I'll let Tracy speak to as well.
So I'd just like to share, when it comes to solution work groups, that is allowing our direct line staff, our screeners, the opportunity to sit together and problem solve as a collective team. That's about our continuous quality improvement. So they were the ones that were able to help identify what the areas of concern are internally, and we worked together, having short-term work groups to problem solve and come up with some resolutions. So one of the things that we've been working on for quite some time, for example, is doing some internal training to our colleagues. Our co-workers from other units tend to make reports into the hotline quite frequently. So we want to share with them some guidelines on doing some reporting internally and doing external and internal engagement. I've had the opportunity as a manager to answer hotline calls. I like to be able to do that, to see what my team is experiencing. And I can certainly let you know, as we are moving away from or stabilizing somewhat with COVID, we are returning back to our pre-COVID days. And so call volumes are up. And so I'm able to talk to individuals who call the hotline, who might, for example, call repeatedly. And I might ask them some questions. For example, President's holiday weekend, right before the holiday on the Friday, the phones were ringing off the hook, and I assisted. And I had a lot of school teachers calling to give reports on a Friday afternoon by 5 p.m. It felt like it was written somewhere that you have to call the hotline by 5 o'clock. And so I was talking to them, and I had asked them questions about reporting and what kind of training they might have had. We have some community groups that often do reports here to the hotline with youth that they're serving who might be over the age of 18. And they heard that they had an open case with child welfare. And so they think that they're obligated to call us even when there's no abuse or neglect issue. So having those kind of conversations with our community members or external partners is a priority with me.
Thank you. Thank you for the report. I have just a couple of observations that I want to make. One is I do just want to say again to the staff, well, first, let me see if there's anybody from the public who would like to speak on this item. I don't see anybody who would like to. I'm going to close the public hearing part and go to the board. I wanted to just say to the staff, this is such a dramatic improvement from where we were that I just want to continue to highlight what a good job that is being done. I am concerned about the 90% number of answered calls, only because, well, maybe I would just make a recommendation that I think it's worth at some point being able to show where you were sort of at our lowest and where you are now, because I think it will help the board understand what's the appropriate range for that number to be at. What I don't know is when it says here that people opted to leave a voicemail, does that mean they were given an option? And so is that 7% in the 90%, or would that 7% be part of, would it be 90 plus that 7%?
No, I think 7% chose the voicemail option on their own.
What I mean by that is then, are they part of the 90% were answered?
No.
Okay, so
the 90% means that there was a live person answering a call.
So what I'm asking is, to get to 100%, would I add the 90, the 7, and the 2 of the numbers that are laid out here?
Correct.
Okay.
Yes.
Yes.
So what I would recommend is that those are the numbers that I think we just need to be able to show the board at this annual report. I just think it's really critical, and I would show a trajectory of kind of low point to high point of where we are now. And the reason I say that is that while 90% are getting a live answer, if 7% are opting for voicemail and they get a call back, because this was the key issue, that if those were all called back, then our response rate is much higher. And that's something that is just really, really important for the board to understand, because for a while, we were tracking these numbers, I think similarly, but maybe not exactly the same. And that 7.25 number, we really want to understand those numbers, because did that give us a chance to call people back or what? That's just going to be very important.
Yeah, Supervisor, I think we can go back and do both the analysis as well as make sure we're indicating a final, what percentage of the callers spoke to somebody at the CAN Center versus didn't.
Right, because we want to be able to say we're on top of it at this rate, right? And really appreciate that point. And also, we have not done, maybe you did this a while ago, but my understanding is that we've not done an after action report from when we were at our lowest. And I think we were answering calls at like a 65% rate. I mean, it was very, very low, very bad. There were so many steps that were taken to get us where we are now. And I think doing some after action that says we got new technology, we worked with the line staff to better determine how to schedule people. That was a big issue. The connection between the CAN Center and the response, that got mechanized, so it wasn't negotiated every time we were going to try to send someone out to go respond to a call. All of those were they were so significant. And the reason I think it's worth doing is when we started on this path, you may recall, we had no one to turn to statewide or nationally that could come in and help us do a really rigorous assessment of our CAN Center. And I think this is an opportunity for us and for you all to be able to share what you learned, how you did it, because we're not the only ones in the country struggling with this. As a matter of fact, I think I was really surprised at how many other jurisdictions were in worse shape than us. And this is the CAN Center, right? So I would recommend, I know people are very, very busy, so I want to say that this is a recommendation, it's not a demand, but I think the record really is also important for future boards even to understand kind of the steps you took, because it's pretty impressive. And then my last point is that I am a little concerned that the neighbor to neighbor program is still so small. I know it's very new, and I'm interested in understanding whether or not we are looking at expanding that to either expanding the African American Community Service Agency's role and or bringing on another nonprofit partner to help us with that neighbor to neighbor program.
Yeah, thank you, Supervisor. And I can respond to that. I think Rocio may be on it and fill in anything that I miss. We are looking at how we can expand to include additional family resource centers. I will say that, the initial several months that we've had this in place, that AACSA has done a really good job of partnering with us to say, what's working and what's not.
Excellent.
And we really want to make sure that as we roll this out, that the family resource centers have the needed resources on site to be able to get families connected. Some of this is connecting into the broader work that CAST is doing around the single system of support. So kind of building this all together. But to answer the initial question, yeah, we are looking at how we can expand out. We've had some discussions with First Five to identify possible second sites.
One recommendation that I hope you will think about is I think having the African American community leadership here is really, really critical. And I'm so excited that that's a big part of this. I'm also very interested in us looking at institutions that have particular expertise in with the Latino community and the Vietnamese community as well. And so what I would like to see is, even if it's off agenda, is just the strategy for expansion. And I appreciate, Dan, the point you're raising is that we had to pilot this first. I totally get that, and we're learning. And I think OXA is such a great partner for us in that area. But no buts, period. And we have these other cultures that we know we have to be able to engage and address at a much deeper level.
Yeah, absolutely.
Rocio, did you want to add anything?
Well, just to the numbers, just to give an example, the non-reports that come in oftentimes don't have all of the information that we need to then be able to do a follow-up with.
That's exactly right. And
I just wanted to give you a small example. So just looking at from like July through December, we had 1,400 non-reports, but only 190 of those actually had enough information for us to even take the next step on. So the number gets really small. So I just want to kind of give that little context. Just so you
and you're talking about the ones that went to voicemail?
No, I'm sorry. I'm referring to the neighbor to neighbor. So
right.
Yeah,
the non-response. That's exactly,
Yes.
Rocio, you're exactly right. That's exactly the kind of information, you're exactly right, that we need to understand and then dig into. You're totally right, which is why one of the opportunities, I think, with bringing a second partner on gives us a little bit of a juxtaposition that we can assess. I think that's a great point. Great point. Thank you. You're always one step ahead of me. All right. Well, Susan, did you have any comments on this item?
I don't. Thanks so much to Damien and Rocio and Dan for the report.
Yeah, just great work, you guys, and not easy work, because a lot of us were watching you. So thank you. All right. We don't have any action on that. We're making some recommendations just based on ideas, not direction. Just wanted to share some thoughts. We're going to move on to item 9, and this is the Welcome Center report. And Dan, I don't think you're moving, right?
No, you're stuck with me again. I am being joined by a couple staff from the Social Services Agency Office of Research and Evaluation, so I'll let them do a quick introduction.
So hi, I'm Christine Ferrer with the Office of Research and Evaluation.
Hi, I'm Ida. Hi, Chairperson Chavez and Vice Chair Ellenberg. I'm Ida Tamarin, also with the Office of Research and Evaluation.
Welcome.
Good afternoon. I'm Kelly Singh. I'm a postdoctoral fellow with the Office of Research and Evaluation.
Excellent.
Thank you. So I'm going to run the PowerPoint here and then let them talk about the evaluation, and I'll wrap it up at the end. So turning it over to you all.
Thank you.
Did we lose Ida?
If someone's speaking, they're on mute.
I think Ida's frozen.
Is there someone else that can?
I'll go ahead and go through.
While she's adjusting. Thanks, Dan.
Yeah, I'll go through the baseline. So, so this is the first quarter comparing. Our baseline cohort was from Q3 of 2020. So that was when we were still operating the old Keiki site at 725 East Santa Clara. And then the cohort 1 is going to be Q3 of 2021 with a welcoming center. So you can see that Keiki during that time, 179 children entered care, so entered DFCS care. Versus 71 under the welcoming center cohort. Newly entered and admitted to the receiving center, a large number during the baseline of Keiki went through the Keiki premise. So 75% of those children touched the Keiki program, whereas at the welcoming center, only 58%. And then I think this is where we start seeing some really stark differences. The average stay at the old Keiki during that time was 4.5 days. And the average stay at the Welcoming Center during the same time, 0.84 days. So a significant decrease in the amount of time that children were spending on site. And then for those children that stayed beyond a day, what did that look like? So at the baseline at Keiki, if a child stayed with us beyond the day, then they were with us for a little over 2 weeks, while we were looking for alternative placement options. At the Welcoming Center, again, if somebody is with them for longer than a day, then that day is 1.8 days. And then looking at the first placement after touching each one of those programs, we don't want children to go into a next placement just because it's available and then it not be a good match, and then that's how they get subsequent placement changes. So from Keiki, you saw that after a month, the child had already had 2 placements, and at the Welcoming Center, after a month, children only had one placement, which is what we wanted to be able to see. So, some of this I think is attributed to the Welcoming Center and the model, and I think that the team will get into a little bit more on that. Some of this is due to the work that we've also done within DFCS on our placement process, and some of the work we discussed earlier around family finding. I think the engagement that our emergency response staff are doing up front, I think is translating into a lot of these outcomes.
So I'll go ahead and take this one. In addition to looking at quantitative data, we're also gathering qualitative data for the evaluation. We've contracted with some external specialists, that's RDA, to conduct focus groups with a variety of stakeholders, including program and management, supervisors and social workers, direct service providers, including our parent partners, caretakers, which include resource parents as well as bio parents, and youth, older youth. So the focus of the focus groups during this first year, is we'd like to know what their experience with the Welcoming Center is, their experience during enrollment and intake, how children and youth are being matched to resource homes, different aspects of service delivery, as well as collaboration and communication.
Thank you, Christine. And actually, before I go to the next slide, one of my main interests in getting this information is when we talk about next steps for the Welcoming Center and DFCS, creating what the new program is going to look like. That youth experience is going to be huge in us developing that program, looking at what's worked and what hasn't worked, as well as the staff. What has worked and what hasn't worked. What I really want us to be able to do is not to create something that's going to eventually get back to where the situation we saw at the old receiving center. So I think being very thoughtful and seeing what works, and then building based on that. And then this is some of the next steps for us. So this goes into the broader continuum, that we are working with the California Department of Social Services to license a couple of our scattered sites. So those individual homes that we've leased, to actually license them as a licensed program. We've also partnered with behavioral health and with juvenile probation on how we can build kind of a joint program around that. Because I know that it's been discussed earlier that juvenile probation really has a need for similar placement needs and especially treatment needs. The board approved additional staff for us to fully staff out our Welcoming Center. That was one of the challenges that we had, is our staffing was still based on the old RAKE model, which was a one site congregate care model. So when we're operating multiple different programs and multiple different sites, the staffing model is a little bit different. And then looking at some clinical staff that'll be DFCS staff to help support those STRTPs. I know that we've had discussions with FAF regarding the O'Connor site. So those discussions are ongoing. I think we can start using some of the lessons learned from the Seneca site regarding floor plans, regarding kind of amenities on site to give us some idea. I do think that these qualitative evaluations will really help guide a lot of that discussion. I think that's the end of the formal presentation, so I'll go ahead and stop and answer any questions.
Thank you. Let me start by seeing if there are any questions from the public. Seeing none, Supervisor Ellenberg.
Thanks. I appreciate the report and the programming. I wonder if you can talk a little bit more about the location bringing this to O'Connor, excited that it's in D4, but I'm having just a little bit of trouble visualizing and understanding how and where we're going to be able to really create a homey environment. Are there parking issues? Does it feel separate from the hospital? Can you talk a little bit more specifically about the physical location?
Yeah, thanks, Supervisor Ellenberg. I think that's still part of the in discussion. I think that there was a request for us to explore kind of the similar site as the CAC in one of the other floors. What that's going to look like, we haven't gone to that point yet, because I think we still need to look at what the model is going to be. The other piece that is factored in now that wasn't when we started this process is the state has made it clear that they want this to be a licensed program. So there's going to be some licensing requirements we're going to have to factor in. There's going to be staff access. There's the, how do we want youth to be able to have access? Instead of going through the main, is there a separate entrance? So those are all things I think we still have to kind of plan out.
Yeah, that which explains why it's hard to visualize right now. Are there other spaces that are being considered on the O'Connor property besides I'm still calling it the yellow building?
Yeah, not that I'm aware of, Supervisor. But again, I'll follow up with my team to see in those discussions if there's been other opportunities that have been lifted up.
Okay, thanks. I appreciate that.
Thank you. I want to just follow up on what Supervisor Ellenberg was just asking about, and that is, I wonder if we have learned anything from the Child Advocacy Center model that could be applied to the Welcoming Center. And in particular, what I'm wondering about is the the parties that are all part of supporting the child, and how if at all that's influencing how you're thinking about the future of this particular body of work.
Yeah, thank you, Supervisor. And absolutely, I think that the success they're having with kind of a multidisciplinary approach to having different professions as well as different agencies involved in supporting is something I think we'd be very interested in the model. I think that one of the benefits we have too is the current Welcoming Center has been partnering closely with the Child Advocacy Center. So they're already learning, I think, from each other on especially youth that are crossing over between the programs. So I think that there's, from a staffing perspective, from the on-site services that would be needed, I think those are all part of that discussion. But absolutely, the CAC model, I think, is something that we can look at for that, specifically for that kind of cross agency and cross department collaboration.
So one request I would make is I would be very interested in hearing from you about how that investigation, what that might yield for future activities. And just to follow up on what Supervisor Ellenberg asked, I think one thing I'm particularly interested in understanding is what are we learning about the services that these children need that may or may not impact whether or not it makes sense to connect them physically more close to the Child Advocacy Center, or if what we should be looking at is something much more, literally much more home-like. And so that's actually one question. And then the other is, since they're not staying at the Welcoming Center very long, what I just said may mean what Supervisor Ellenberg raised is really important, just in terms of making sure that there's a lot of resources for that child initially to get appropriate placement. And if proximity and integration of services enhances that, how do we make that happen sooner rather than later?
Absolutely. And I think, regarding the services on site, I think, the Seneca team that's currently doing that has a lot of experience and also has a lot of insight into what's worked and what hasn't worked. And, I think the physical location, I think my recommendation would be that we have something that looks less institutional-like and more like a family setting, especially, these are going to be 100% children that have experienced a really recent either placement disruption or removal, and a lot of trauma. So I think whatever we can do to make it feel more like a home, while also making sure that we have, co-location or access to the services that may be needed, either, behavioral health or medical.
And it may actually mean too that, back Supervisor Ellenberg, to the point you're raising, that we are looking at designing something, because I'm just not sure that retrofitting, like I think the current center is very well done, but it's a retrofit into a building versus us being able to say, here's what we've learned, here's what we know, and here's the very best way to have those services integrated. And what I mean by that is that, well, you know, you've been to the building, so there are some issues that I think are just worth us, you know, thinking about. And Supervisor Ellenberg, part of the reason I'm raising that is I've been thinking a lot about the hub. And when we tried to, you know, the hub had been moved many times, and it's literally in an industrial area, as you know where that is too, and it doesn't have it doesn't feel like a community center. It feels like a place we've settled on for kids, not settled on, but you know. So anyway, I just think it's worth us deciding whether or not we need to prioritize the reconstruction of something, maybe even from scratch.
Here's if I can add in, I really agree with you, and I do have concerns about the yellow building, but also given the challenges and the, you know, and the traumatic situations that these kids are facing, and some of the concerns that occurred when they were so close to other neighbors on Enborg, while a house, something that feels like a house, is the right kind of environment, a residential neighborhood is not necessarily, especially since this is very short term in and out, isn't necessarily the right answer either. So what I'm thinking about, and I don't even know if we own this building, and I don't want to get us into trouble, but across the street from the yellow building and between the yellow building and the pain center is sort of a small one level building. I don't know if we own it or not, or who's using it, but it seems like a standalone one-story building. We would have a lot more flexibility to really retrofit and make it seem homey while still being on that O'Connor campus, and not between two residential neighbors that may not have a sufficient understanding or empathy for what needs to happen there, and how the kids need to be engaged and supported while they're there. So I'm interested in really exploring the O'Connor campus and seeing if there's any space there that does have a direct entrance that we really could make look very homey. And I hear what you're saying about the hub, but it doesn't feel settling to me just because it's on this great corner, and it has transit, and it has the shopping stuff across the street, and it's kind of
no, I don't mean,
you know, between Willow Glen and
not the new.
Oh, good.
Yeah,
okay.
no. Oh goodness, no. I would never. You know, we wouldn't have built it there. But no, I'm just talking about kind of what happened with the current location. Just and I think part of it is design matters, and I think we're all learning that, right? So yeah. Thank you.
Yeah, absolutely.
Yeah, you and I are in total agreement. So we'll look forward to hearing. In fact, what we may want to do is just ask Dan if we could get a 3-month report out from you and Fleets and Facilities, just about how you're thinking about it, you know, or 3 or 6 months, whatever you think is most appropriate.
Thank you, Supervisor. We can report back and on potential timeframes, but yeah, we'll start working on that.
Yeah, that'd be great. Really good. Okay, well, I want to say thank you to the staff. Oh, I have one last question. Do we have enough resource homes? That volume of young children is higher than I remembered.
Yeah, I mean,
how are we doing on that?
The need that we really have are for homes who are able to work with our children that have experienced more significant trauma. And that's what we're continuing to build up, both with our foster family agency partners as well as with our county homes. The state has actually given a little bit of flexibility to look at those intensive kind of treatment type homes for county homes. So that is something we've actually started to do in a couple situations. So.
And do you have the resources you need to make that expansion right now?
Yeah, and that's actually what we're in the planning right now.
Great.
Yep.
If you wouldn't mind reporting back on that too in the next report, because I think these are all really tied together, because part of the success of the Welcoming Center is, do we have safe places for the children, right? So. Absolutely. Great. Good. Well, no action needed on that. Thank you very much. Good work, all. We're going to move now to item 10, and this is the transgender, non-binary, and gender expansive recruitment and retention efforts. Sarah, are you our lead presenter today?
I am, and good afternoon, Chairperson Chavez, Vice President Chair Ellenberg, and committee. Thank you for the opportunity to present transgender recruitment and retention. Sarah here, and I'm the Senior Management Analyst of the Office of LGBTQ Affairs, as well as the Interim Manager. In this report, you'll find also an updated overview of transgender recruitment and retention with proposed timelines, as well as this presentation deck. Just to recap what Transgender Recruitment and Retention Initiative is all about. This initiative is to increase outreach and opportunities for transgender, non-binary, and gender expansive applicants, employees, and vendors, and strengthen retention rates at County of Santa Clara by creating an affirming workplace for trans, non-binary, and gender expansive folks to thrive. And please note for this presentation, I'll be using the acronym TGNB when referring to transgender, non-binary, and gender expansive people. Our office's strategies in achieving this goal are to invite community input, survey TGNB people to identify the ongoing barriers TGNB people face, especially regarding employment, and develop pathways to address them. Advanced trainings and administrative guidance to ensure TGN people feel safe, welcome, in the workplace, and expand programs and hiring efforts to be inclusive of TGNB people with a specific focus on transgender women. Since the September 23rd, 2021 Children's, Seniors, and Families Committee meeting, some of the work that has been done include the completion of the Transgender Needs Assessment Community-Based Participatory Research. That report is going to be available in May 2022. The availability of a new Overcoming Unconscious Bias web-based training available for all county employees, and efforts with Learning and Employee Development Department in amplifying training availability and measuring usage. Collaboration efforts with the new Office of Diversity, Equity, and Belonging, and receiving guidance from our Office of on LGBTQ cultural competency trainings for their review, oversight, and recommendation. The availability of TGNB culturally competent trainings and presentations from vendor TransCan work in reducing anti-transgender bias and creating gender-affirming work environments. And the completion and availability of Employee Service Agency Human Resources Interview Best Practice Guide for county departments to reference when conducting interviews. In expanding our reach to TGNB communities, proposed programs under this initiative also include a Santa Clara Countywide Transgender Employment Survey to provide deeper insights to barriers to employment. This final report is going to be available in June 2022. We also have a transgender economic environment pilot to address broader employment gaps. This includes our TGNB roundtable that's kicking off this Saturday, March 26th, and a transgender inclusion fellowship that gives prospective employees committed to transgender inclusion an opportunity to work within county and improve our TGNB pipeline to future employment. Our vision is to have fellows in county departments and offices after the fiscal year 2022 to 2023 budget cycle. And that concludes our presentation. We're open to any questions that you folks might have.
Thank you, Sarah. We're going to first see if there's anybody from the community who would like to speak. We don't see anyone, so we're going to close the public hearing, and I'll turn to my oh, we do have one speaker. Oh, no, we don't. Now we do.
Looks like their hand is back up, Madam Chair.
Okay.
The next speaker is Kathleen King. I'm unmuting you. Please accept the unmute. You'll have 2 minutes to speak. The timer will start when you begin speaking.
Hello, this is Kathleen King from Healthier Kids Foundation, and I did just get to join. I don't need 2 minutes. I just am wondering, this training that will be available for the county, is there a possibility it could also be available to the nonprofits working in the community as well? And thank you. I'll give you back 1 minute and 40 seconds. Thank you.
Thanks, Kathleen.
And that concludes our request to speak.
Thank you. Sarah, did you want to respond to that?
Absolutely, yes. Training from TransCan Work has actually been held last month in February. So training could be available for the community. Right now, we're exploring more county-wide efforts, not county, I'm sorry, county-specific departments and agencies for TransCan Work training. But yes, training is available. On top of that, there's multiple options for sexual orientation, gender identity, and expression trainings offered by our office, as well as many of the LGBTQ+ service providers and community-based organizations that we work with. So in terms of training is available, and training is available for both vendors as well as the organizations that we work with, as well as our office.
Thank you so much. All right, I'll come back to the board. Supervisor Ellenberg, do you have any questions? You're on mute.
Yeah, just a few. Thanks, Sarah, very much for the report. It was really good to hear that ESA has finally has finalized the interview best practices guide for county departments to reference when they're conducting interviews. Do you know if it's been distributed to all county departments for their use?
As far as I know, from my conversations with ESA HR, everyone from ESA HR has received the guide, and it's right now it's in the process of being distributed to other departments that are requesting for it. I'm not sure about the timeline as to like full distribution, but as for their plans with its new release, it's being first introduced in ESA HR, but it is widely available.
That's great. And I think that rather than relying on departments asking for it who really just may not even know that it exists, unless you think that there's a reason why we shouldn't do this, I would recommend just letting all departments know that it's available, sharing a link. That also gives us kind of a baseline to start to get feedback on its implementation, to see how interviewers are using it and how widely recognized does it become. And I would like, could you share a copy of it in an off-agenda report to the board?
Yes, I can partner with ESA HR to be able to get that.
Thank you so much. And I see also that the objectives that are to be completed by spring are pretty extensive. And I know that your office has several open positions. Are you able to share any idea of when you think those positions may be filled?
As far as I know, the open position for manager has been, that position or the application process has closed. So right now that's in process. As far as the open program manager 1 position, that is to be opened up, I believe by the end of March, so end of this month.
So do you have concerns that lack of a full team may cause any of those objectives that you've laid out to be deferred?
Not necessarily. When it comes to some of the major reports, such as the transgender needs assessment, that one has already been completed, and right now we're just in the process of ensuring that the report looks cleaned up and good to be able to release. So it's been completed. It's just that we're working on the graphical design element to make sure that folks are able to digest a lot of the report that's in there. As for the transgender employment survey, that is due by June 2022, where right now we're just swimming along in terms of making sure that everybody has an opportunity that identifies as TGNB to be able to take the survey. The reporting has already been getting started in terms of like the templates and stuff like that. And as for like the interview process, that's happening. So both of those are being completed by vendors. So there's no concern for us to be able to delay those reports.
Okay, that all sounds really good. Thank you so much. I appreciate getting the updates and look forward to the next iteration.
Thank you.
So I don't have any questions, sir. I just wanted to say thank you for the report. My questions actually got answered by Susan's and Kathleen's question about the trainings. That's not the first time I've had that request. So I'm really excited that you're going to be able to package those. One acknowledgement I wanted to make is that I understand not only are you down staff, but the staff you would normally have are in DSW workers still. So amazing amount of work that you've accomplished all by your lonesome and with the help of a consultant. So well done. Thank you.
Thank you so much.
All right, so we're going to move on to item 11. This is period products in county facilities, and I believe I'm turning this over to Sylvia Gallegos.
You are. Good afternoon, board members or committee members. Sylvia Gallegos, Deputy County Executive, and I am here to provide an update on our efforts to implement free period products at county facilities. So first, I'm pleased to report that procurement has executed an agreement with Staples Office Supplies on March 3rd for the provision of these products and dispensers, related equipment, and also for the installation of the equipment. Secondly, we do have a work group that's been assembled for the last few months with representatives of county departments, including all 3 hospitals, for the implementation. We've assigned a maintenance project manager from FAF who is leading the process, not only for assisting the departments in securing the products and dispensers, but also for the installation in over 1,000 restrooms. We are right now in the process of finalizing the restroom locations, verifying them, dispenser models, product brands selected, and as a footnote, and I think this is a welcome note, AntFlow organic tampons and pads and dispensers are available to be selected. And we've created a SharePoint site to coordinate all of this work because we do have quite a number of departments and facilities, as I pointed out earlier. We are at this moment poised to place our first order with Staples, and particularly for the dispensers, and there's a lead time for that. So the estimated start date for the start of installation of dispensers and products is in about 4 weeks. There's a 10-day lead for the installers, and I've requested that the Civic Center be one of the first locations. So I'm hoping that in 4 weeks' time, you'll begin to see them installed. We're going to have to coordinate with all the facility managers because obviously that puts restrooms out of use when we're doing that. I'm also pleased to report that all social service agency leased facilities will be included in this first phase of the rollout. And then finally, with respect to period products and men's bathrooms, the LGBTQ office did conduct a focus group with TGNB persons to evaluate the impact of installing dispensers in men restrooms. And the input we did receive was that people would not feel safe seeking these products in an open setting. So there has been some discussion about whether dispensers could be installed in an enclosed area. The only ones that make sense, because the partition walls aren't built for holding these equipment, would be possibly ADA stalls. But it does require a restroom by restroom evaluation. And because we have facilities that are constructed by different materials. So we may have ones with concrete, we may have some with conventional 2x4 drywall construction. And then we need to ensure that the equipment complies with both building code and ADA requirements. And also, the second piece to this is that I have convened the LGBTQ office a few times to discuss its capacity for education and awareness at specific work sites before we install dispensers and products in men's bathrooms, as well as the messaging on any signage we would locate. And the intent is to establish a foundation of empathy and support before we install this equipment. We are concerned in some male-dominated work sites that without that foundational work, there will be, at a minimum, confusion. As you heard in the presentation that just occurred, the LGBTQ office is constrained with a lack of staffing capacity. As you know, and you just heard, we've had some vacancies there as well as some people activated for DSW work. So we are trying to work through what their capacity would be to support further work in this area. But the good news is the long-term plan for the county is develop an all-gender bathroom standard for future facilities. So picture a bathroom where everybody goes in, and we'd have floor-to-ceiling stalls, and we would, pursuant to plumbing code, have a need for various features, including urinals. But the good news is, in the future, people that are non-binary or gender expansive wouldn't have to make a choice between bathrooms. And frankly, it's much more efficient. We already have work sites where there isn't sufficient facilities for men. So with that, I'll conclude the comments, and I'm available for any questions you may have.
Thank you. I'm going to go to the public first to see if there's any comments from the public. I see none. I'm going to come back to the board. To us, Susan, you and me. Susan, do you have any comments on this item?
I don't. Thank you. Thanks, Sylvia.
Yeah. So Sylvia, here just a couple things I wanted to ask, and I forgot, or maybe I didn't remember that we had staples in our initial RFQ RFP. Did we ask for an education component as well, like a partner who could help us do community education?
We did not. We were focused simply on the supply of the product and equipment. We're expecting that we could handle that in-house, frankly, at the time.
And then the second question is, are these biodegradable products?
I don't know the answer to that. I
Okay.
believe the expectation is that they would be used products would be disposed of in receptacles in the stall.
The reason I'm asking is that the initial partner organizations that we brought to staff had both education capacity, and they were looking at products that were also good for the environment. At least two of them were, and so I'm a little concerned where we landed. A little bit further away from where we started than I anticipated. And then the second question is that I saw that, and I know that Sarah was talking about doing a survey, and I'm presuming the survey that's going to go out will have some questions around this subject matter.
So I see that Sarah's joined us, and yes, we did have discussion about getting more data points, but before I hand it over, I did want to clarify that the request was for organic products, and those are the initial board referral was for organic products as well, to consider those, and those are available through this procurement.
Oh, okay, so that's what we're buying.
Yes. That is, so yes.
And I understand the point you're raising, everybody gets to buy what they want, but I think when it comes to stuff like this, we want to, I really was thinking about the biodegradable product, and I appreciate the organic, and I missed biodegradable on my own, but at least one of the vendors we talked to that was very exciting to me, both had an education component and also this ability to have a product that was going to be good for the planet as well. And that's what is, what I'm just recalling. So Sarah, could you talk just a little bit about the survey tool?
Yeah, so if we're talking about the trans employment survey, the questions allow for open spaces for folks to be able to talk about restroom accessibility. But again, this is more of a general county-wide survey and not necessarily a internal survey for county employees. But we did, through our survey back in August of 2020, we did receive some feedback in terms of not necessarily menstrual products being available, but more so the availability of gender neutral restrooms for non-binary and gender expansive folks. So that was of greater concern than menstrual products being available. So that's a data point that that I can share.
And Sarah, is it your take that one is a less, I mean, I'm thinking about this hierarchically from a need perspective, and to me, as I'm thinking about this, I'm thinking about the safety in restrooms and all that being a bigger part of whatever that overall need is. So my question is, to get to the bottom of this question about how we should go about moving on this, what would be your recommended approach?
My recommended approach would be to ensure that folks know about our plan in terms of menstrual product equity for anyone that menstruates. Although it might not be in this kind of like phased approach or in this initial phase, it should be somewhere where our county can explain that in this phased approach, like Sylvia was mentioning, in terms of having all gender restrooms being top to bottom, kind of like stalls, that kind of phased approach, and being able to explain that to the public would be much more approachable. In terms of the focus group that we convened back in October, they did have or expressed concern in terms of accessing free period products or free menstrual products in the bathroom in a public setting. So that was of their concern. But if there's anything that I would recommend is being able to, for our county to be able to explain that in our framework, we should have a plan for menstrual products to be available to everyone through all gender restrooms. And if our research actually goes towards menstrual products being available in men's restrooms, then we'll move forward with that. I'm not sure if that makes sense. But
yeah, no, it really does. And what I'm gonna recommend, and this has been really a very helpful discussion, and I think a couple things. One is that I think it's worth us even having a deeper dive in the all gender restroom, like what the county's approach is, because as I'm listening to you all, I'm not sure I know what it is. And I do think that there's a lot of education that has to go forward under all circumstances. I think for folks to feel safe, whether they're women, men, trans, like irrespective of where someone is on relative to their gender. And I think that's actually such a bigger question. And then I think, but part of it I also think is people feeling welcomed, and how you feel welcomed is having the resources you need to feel safe and welcome in a place. So perhaps what we should do is, I'll give a little thought to this, but the direction I would like to give is that we have a discussion back at this committee about the overall approach that we're taking as it relates to restrooms overall. And then I would need a little bit more refinement on the outreach and the education. on the outreach and research component, and then how we think the education should or could work. Like, what are the best practices around this? And like I said, there are some other it wasn't just Staples, but we had other companies that approached us, and a lot of those companies, not a lot, there were 2 of them. Of those companies, they really, a big component of what they were offering initially was education. And I think there would be some value in us considering a partnership with at least one of them that has the educational component, because I think we could learn from what someone else already did and not start from scratch. And those would be just recommendations. Well, I'll give them I'll make that as a motion. And Supervisor Ellenberg, and that would be to have what our overall plan is relative to restrooms, the phased approach relative to menstrual equity, and then third, the research that Sarah's doing, just so we understand that.
Happy to second that.
Thank you. And as part of that motion, I do want to request that we reach out to the firms that have an education component, even if we need to do a small consulting contract with them. I just think we would benefit a ton from learning what they've already learned. And I know Sylvia always tells me about these things. They're always more complicated than one thinks, always. So I appreciate that. All right, Supervisor Ellenberg, are you comfortable with that?
I am.
All right, so that's a motion. I will make a second. Thank you both.
Are you ready for a vote, Madam Chair?
I am, sir.
Vice Chairperson Ellenberg?
Yes.
Pardon me, and Chairperson Chavez?
Yes.
Thank you.
Thank you so much. We're going to now go to item 12, and Consuelo is going to educate us about housing and childcare for survivors of gender-based violence.
Thank you, Chairperson Chavez and Vice Chairperson Ellenberg, Consuelo Hernandez, Director with the Office of Supportive Housing. In the interest of time, Supervisor Chavez, I will make my presentation short. As you know, over the past year or so, our office has been working very closely with the Office of Gender-Based Violence Prevention. Carla Collins and I have been hosting meetings with several providers of victim services to understand the needs through different phases of what I will frame as recovery, both looking at the short-term and long-term needs. One of the things that we have found is that in some instances, survivors need longer than our standard rapid rehousing or temporary options, where rather than a 2-year period, it's something longer like 3 years, but not as long as the way that we have designed our permanent supportive housing programs. So through those conversations, we've been looking at opportunities to come up with new housing solutions around that. And through the Heading Home campaign, looking at opportunities to shift funding around in support of childcare services. The way that the funding works is childcare services are basically permitted use, but the majority of the funding currently goes to support the rental revenue, or what we refer to as the rental subsidy needed to help the person support. And by leveraging the emergency housing vouchers and redesigning the service delivery model, we think there's an opportunity to test some things out in the way of reallocating those resources that are already approved by the board as part of our base budget, and just recasting them to support the additional childcare needs. And then the balance of the work that we're doing is really focusing on system improvements. Currently, we are revamping our assessment tool that is used to determine a person's vulnerability. We are hosting workshops. We have representatives from all of the victim service providers attending those sessions. It will take about a year to go through that process, but we're in active conversations. We're also working on the data and coordination. If you recall, there's a difference between the number of survivors that we see in our homeless system versus what is captured in the queue that is managed by the survivors. So we are continuing to work through those confidential queue and community queue coordinations, and meeting every quarter now with the DVAC group to really get on the same page about making sure that we're not leaving folks behind, that we're serving them both in our housing system and through the services that are provided by the victim service providers. Happy to take any questions, Supervisor.
Thank you. I'm going to see if there are any comments from the public. I see none, so I'm going to close the public hearing and go back to the boards. Susan, did you want to chime in?
I do have a couple of questions for Consuelo. I wonder, thank you so much for the report and for continuing to work on behalf of this population. I wonder if you could walk us through sort of a verbal flow chart of access. Let's imagine somebody calling, calling the hotline or calling whatever the phone number is late in the evening. What are the steps for them to connect with services, to get to a safe bed, and how many actual points of contact or steps are needed?
Thank you, Supervisor, for the question. I will share with you what it looks like on the if a survivor is calling our centralized shelter hotline. Okay. The very first question that we ask is about safety.
So I'm going to even back it up a little bit further. I apologize for the interruption, but let's start with the call. Is it available? Is somebody answering the call 24/7? Is somebody answering it who has multi-language capacity? If someone doesn't speak English, I'm going to just really drill it down so that I can understand how it works. So ring, ring, somebody's calling. Is the phone answered 24/7? Do they need?
Yes. So the call center, and so I am referring to the Here For You hotline that is managed by the Bill Wilson Center through a contract with the Office of Supportive Housing.
Right.
That call center hours is between 9 and 7 p.m. Because the hotline has experienced more calls than we anticipated or originally projected, we have been leveraging our office staff and our disaster service worker teams that are managing the hotline for isolation and quarantine to provide some of the additional translation services. If you recall, we've been, over the last 2 years have perfected some of those call intakes, and there's a lot of lessons learned from that we've applied with the Bill Wilson Center. We are also staffing some of that hotline through a partnership with the social services agency that is giving folks the opportunity, people with a previous experience of homelessness, the opportunity to actually work through a subsidized employment program that we started. And so there is translation services that are available through that. So somebody calls the phone through the call center 9 to 7, and then that's when they get asked the question.
Okay. So that's where I started interrupting you. So I'll stop and let you continue until the next hurdle that I don't understand.
No worries, Supervisor Ellenberg. I mentioned in a separate conversation with Supervisor Chavez that this is exactly what I do to learn. I put myself in the position of the beneficiary or the recipient of the service to identify exactly how it works. So through our office, also the benefit is we are tracking all of the beds for transitional housing, emergency shelter that are managed by and participating in the hotline. So this does not cover a shelter bed that is not within our system. There are a few that are not currently managed. Our goal is through the Community Plan to End Homelessness to get all of the available shelter beds throughout the county to participate through this hotline. So what our staff does is they have access in real time through our homeless management information system to determine if a bed is available.
Okay.
And if a bed is available, then that's the first entry point or first option of an entry point to a person calling in who is experiencing either fleeing domestic violence or is in need of a shelter bed.
And so I'll interrupt again to ask first, is there a plan B if a shelter bed isn't available? Do we have a hotel voucher or some other option? Number one. And number two, if it is available, are there still additional circumstances to consider to protect that person's safety? I assume they don't necessarily want anybody else, even strangers in this shelter, to know where they are. They may need a more private space. Are these congregate shelters or individual room shelters?
It's both, Supervisor, and hotels. And again, these are just the beds that we manage directly.
Right.
If the person calling or the household calling is a family, as you know, through the Heading Home campaign, we've been able to expand our shelter program for families. So if there is no family shelter bed available, then they are referred to a hotel through our Amigos de Guadalupe contract.
Okay, so by referred, we can in that same call say there's no shelter bed or no appropriate bed for you, so you can go to this hotel. There will be a room waiting for you.
Correct. Then there's coordination that happens with our outreach teams and the Bill Wilson Center.
Okay, coordination, and the person is still on the phone waiting to be told where to go?
Correct.
Okay. And then do we transport them there?
Currently not, Supervisor. The transportation, we provide options, but we don't have transportation like we did during the pandemic.
Mm-hmm. So what does an option look like?
Sometimes we provide either a taxi, rideshare option, or bus tokens. It depends on the needs of that family or the person that's calling.
Oh, okay. But we do support them in getting to wherever we're directing them to go.
Yes, we provide, it's just not, we don't have a driver, if you will.
Got it. No, that's fine. I didn't mean to imply that. Okay. And then they've gotten to the place, and if there wasn't a place available, we've gotten them to a hotel. Is there a circumstance in which we would tell somebody who is fleeing or in danger or has nowhere to go, so sorry, can't help you tonight? Assuming they call before 7?
Yes, it will happen, Supervisor, in certain instances. These are the types of conversations that we are having with the providers, because they are also the entry point. And one of the challenges, how do you capture all that information?
Right. And are we finding consistently, is there a shortage of beds? Is that why we're turning people away? Because between the shelters and the hotels, we don't have enough space to meet the demand on a particular given night?
I will have to get back to you on that question, Supervisor Ellenberg. We've been digging into this specific area just over the last 6 months. So there's a ton of questions that we still don't understand. And that we're learning also from the victims service providers.
I so appreciate that. Thank you. And I'm just thinking, I learn visually, and I like charts and tables and flows and maps. And I'm thinking, since you have all of these questions, I have questions. I wonder if there's, some way that we can be thinking about putting this together. What are all of those FAQs? What are all of the flows, so that as we get information, we can fill this in. So, at some point, if not today or this month or next month, when this system is very smooth, we can really lay it out so that people, both people using it and supervisors trying to understand it, can have a very clear picture of what the access is and what it's supposed to look like, so that if we run into the case where someone who's trying to use the system doesn't have that experience, we'll be able to troubleshoot and see what broke down or what maybe we haven't answered or addressed yet.
Yes, absolutely, Supervisor. Those are the workflows that we are hoping that one of the outcomes of these meetings comes to that. We're also working on currently the data that's being collected isn't in a report that we would like. So we want to try to create a type of dashboard, if you will, that we can actually analyze and do what we do with our larger system. But just have it more focused on survivors and the experience if they call the hotline, and what are the improvements, and really looking to the victim service providers and the beneficiaries of the services.
That's great. Thank you so much. This is really, really good, important work, and I appreciate that we're persisting and working to continuously improve and smooth out the system. So thank you.
Yeah, thank you also, Consuelo. I just have a couple of comments. One is that I think, after you've had an opportunity to dive more into this, that it would be great to have a conversation at our August Children, Seniors, Families Committee meeting, because I think that being able to check in on a couple of the key issues that you raised, one, Supervisor Ellenberg's point about what's the flow chart, I think is a really great question. Two, and Supervisor Ellenberg, this is something I'll share with you, that I had asked Consuelo, as part of the work that we've been doing relative to victims of domestic violence, to have conversations with Community Solutions in particular, but I think this is something that could be done with many of our nonprofit partners, to take a look at the how they do housing, whether or not there were partnerships that we could have there with some Measure A money, honestly, to expand the amount of homes that were available for families, even if they were at an interim use. And so, for example, I was very interested in seeing if it might be possible for us to purchase fourplexes or something along those lines, so that it would allow service providers to be able to provide services in one location, but also give families enough privacy and all that as they're moving on their recoveries. all that said, one of the things that I did not count on was one of the challenges that we've had between our staff and the domestic violence agency service providers is a high level of concern around confidentiality, and how that confidentiality gets managed, how they manage it versus how we manage it. But the other is that many of them don't want to use the BDAT SPDAT. I always say that name wrong, Consuelo, right? It's, what is it, BDAT?
BI SPDAT.
Yeah, I always say it weird. But in any case, that they're concerned about, their folks don't want to be in the queue. And one of the concerns I have, Susan, is that if somebody isn't a victim, a homeless family isn't already a victim of violence, they're going to be in a day or two if they're on the streets. And so how do we manage all of those interests? So I will make sure that, Consuelo, I'd love a flow chart, and then whatever the learnings are to come back to us in August. And then also, Consuelo, I'm interested in whether or not, because I guess we could do this as a referral, but whether or not we ought to take a look at any of our Measure A funds for these purchases, and if for purchases of these types of homes, and if by doing that it means that we would make it a requirement that we're using VDAT SPDAT. And I don't know the right answer to that, but if you could help us think about that from a policy perspective, I think would be really an important discussion point for us to have. And then I do want to just encourage you to complete the work with Community Solutions. It would help me understand whether or not I need to bring something forward to the board separate, or as part, as either part of a budget action or just a policy change.
Yes, thank you, Supervisor Chavez. I think overall the challenge with the vulnerability assessment tool that we use is, are the questions that are being asked accurately capturing a person's acuity and need? And are the programs that we fund designed in response to those that need it most? So we as a community have decided and made a commitment that those that are most vulnerable, dual diagnosis, severely mentally ill, that have a disabling condition, that need services, rise to the top. And so I think there's an opportunity to look at the way that we frame and ask the questions. But there will always be people that don't rise to the top because of that acuity level, because there simply aren't enough resources countywide to help everybody in need. And we are playing a bit of catch up, right? Mm-hmm. And I think for us, in our office, in our charge, we look at the 424 households who indicate that are currently fleeing domestic violence in our queue. And so making sure that there's an equitable distribution of services, particularly for those that are literally homeless and are actively fleeing, and balancing that with the needs of other survivors, and reducing and preventing the trauma that they experience because of their current situation. So it is a very challenging policy decision to make. And I say that because I don't think the vulnerability index or the tool is the core issue. It really comes down to balancing the needs of the populations that come in to the system that need our assistance.
Well, I mean, I think you raise a good point, because the tool is a reflection of our values. I think the challenge is that we have not had at a board level, at least in my recent memory, a robust discussion about how that tool is used and who we do consider most vulnerable. Because I think the point that you raised is, you rightly, I think, interchanged the language around acuity, need, and vulnerability. And when I think about vulnerability, I really am thinking about women and children. And then you look at, contributing factors like domestic violence. And I think the point, and then we have veterans. I mean, the point you're raising is really a good one. And at some point in the near future, I think the board needs to revisit the tool, because that's been something that has really been in the hands of all of the you and Destination Home and all of our partners, but no buts. But I think that I guess this is a but. I think the challenge is that we haven't really been forced to grapple with what we're asking you to grapple with, Consuelo. And so I think there may be an opportunity to bring that to the board. I'll give some thought to that, Supervisor Ellenberg, because it may be something that we want to think a little bit about together, since I just sunshined it with you and we're dealing with the Brown Act. So, Consuelo, anything else you want to add?
Just to share, Supervisor, that the work that we're doing, the supportive housing system really launched around 2016. And originally, before the pandemic, we were scheduled to do an analysis and a study of the performance of the system and constantly evaluating it. The good thing about the work that we do is we have a tremendous amount of data and we make adjustments throughout the year. But really, we are overhauling our system delivery model. And so that will come to the board. I don't have the exact time yet. But we are scheduled to share with you all the progress that we've made and some of the changes that we're proposing over the coming year.
Great. And do you ballpark?
Well, we are anticipating to share these improvements when we release the State of the Supportive Housing System report for 2021. And we anticipate that the draft will be ready next month. So it could come to the board before the summer break or in August.
Great, thank you. Thank you. Susan, did you have any other questions? Consuelo, thank you very, very much. Did you get the list of flow chart presentation in August? Along with just being able to highlight where the challenges are and then giving us a report back off agenda is fine on the progress with community solutions. So I know if I am bringing a policy change or a budget request.
Yes, thank you, Supervisor. And we are having ongoing discussions with community solutions, really testing to see how we can help organizations like community solutions that are interested in small scale ownership sites and what that might look like.
Yep, thank you so much. All right, thank you. We're going to go on to the Office of Children and Families Policy Report.
Good afternoon, Chairperson Chavez and Vice Chair Ellenberg, Rocio Luna, Deputy County Exec. I will just keep this brief and let you know that the recruitment for the Chief Children's Officer who will lead this office is on track, and those interviews are set to happen at the end of the month, and we hope that by the end of the month we will have a strong candidate. It is a fairly strong pool, and I just want to mention that last month there was a request from Supervisor Ellenberg that everyone in the pool get notified or be notified of their status, and I did confirm with our executive recruitment team that notifications have gone out to everyone that had applied in this recent round. And then of course, when the Chief Children's Officer is hired, that person will also be the one to hire the Senior Management Analyst for the position. With that, happy to answer any questions.
Any from the public? I see no hands raised. I'm going to go right to Supervisor Ellenberg, who took herself off mute as soon as you popped up. Go ahead, Susan.
No, thank you, Dr. Lynn. I appreciate the update. I heard two things, and I just want to see if they are, I assume they're sequential, but I want to make sure that they both happen before the end of the month. You're going to interview X number of people and have a recommendation by the end of the month?
There are two panels that are set for, I believe it's March 30th, and then the finalist candidates will have a final round the very next day. So they're scheduled, right a day apart. And so we hope to have a candidate by the end of, I think it's April 1st. So that is really good news for us, and fingers crossed. It is a pretty strong, diverse pool, is my understanding.
Fantastic. Fingers, toes, everything. Appreciate it. Thank you for the update.
Thank you.
Susan, thank you. Rocio, no pressure.
Thanks.
Oh, she's yeah, thank you, Dr. Linda. All right.
You're muted, Supervisor Chavez.
I just wanted to say how excited we both are. I mean, there's just a lot of enthusiasm here. That's what you're hearing from the
Absolutely.
Item 14 is an update on Title IX.
Good afternoon again, Sylvia Gallegos, Deputy County Executive. We have in the packet our latest quarterly update regarding our procurement process for I'm just going to briefly say Title IX consultant. You'll recall that in 2021, we conducted an RFSQ. We selected and negotiated an agreement with a vendor. The vendor withdrew the day before. We started again this calendar year, and we're in what I would describe as the evaluation process. So I can't share specifics with you now, pursuant to our board policies relative to solicitations. I will say, though, I believe at this point that it's going to take longer than I had initially anticipated, given the need to obtain additional information. And with that, I'm available to respond to questions, but am somewhat constrained in my ability to respond.
All right, so I'm going to see if there's anybody from the public who would like to make a comment on the non-response. Kidding, totally kidding. I see no hands. I'm going to come back to the board. And the only thing I would ask is, I didn't understand the last part of what you just said, but from a timing perspective,
I would just offer that originally in our work plan, I was hoping that we could bring an agreement to the April 19th board meeting, but I don't believe at this point that that will be the case because there's going to be work that I hadn't anticipated, or the team hadn't anticipated as we develop this work plan. I think that's the short version of that.
Okay. All right. So I don't know how to ask a question to that. So you have stumped me, Sylvia, which rarely happens. All right, I have no other comments, and neither does Susan. Thank you for the update. All right, we were going to go on to verbal reports, and Chief Garnett.
Good afternoon. I don't have anything to report. Happy to answer any questions you might have.
None for me. And Supervisor Ellenberg? Nope. All right. Thanks, Chief. Thanks for being with us. I'm going to now go to social services. Hello, Bob.
Hey there. Just wanted to give an update on a couple things that are going on. Pandemic related, I think as everybody's aware, there were a number of different things that happened related to the declaration of a public health emergency and the waiving of certain provisions as it relates to some of our programming. And you know, the good news of the pandemic subsiding here a bit in terms of the most recent wave does mean that we are potentially facing some of the winding down of some of those declarations. So what we're currently anticipating, barring any sort of future surges or changes to that respect, is some changes that will affect our programming around Medi-Cal and the redeterminations that have been suspended that we will need to resume that work. Currently, the plan is around a 14-month window to prepare for that work and then conduct the work, with redeterminations presumably beginning sometime in that June, July period. Our caseload is currently around 437,000 cases, and that's up from a pre-pandemic number of around 369,000 cases. So there's two factors that weigh into that. One is an increased need, but also that growth is partly potentially due to the non-redetermination of cases. So we're awaiting formal guidance on what the next steps will be, and then we'll be able to dive in and do a little bit more analysis of what we think the impacts may be. What I think the good news on this is that federally at the federal level, CMS has provided some urging and guidance to be very thoughtful in this redetermination process, and to that extent, so has the state through DHCS urged a very careful and thoughtful process around redetermining. So, what we'll need to do is touch every case and not simply just discontinue because you fall off a cliff time-wise, that kind of thing. So a lot of concern there, but also hopefully the time to do this in a thoughtful manner to ensure the accuracy and continuation of as many cases as possible. Also, we anticipate the ending of the CalFresh emergency allotments, maybe in the June timeframe. As folks remember, may remember, there's during the pandemic, the allotment for CalFresh recipients was increased up to the maximum allotment, and if you were already at that level, there was a small uptick for some folks there too. What essentially this means is that of the 67,000 CalFresh recipients that we have currently, each and every one of them will have their potentially have their benefits reduced. So it'll be a pretty big impact, and again, not at a great time given all that consideration for all that's happening kind of in the economy right now and the increase of costs and still people trying to see their way clear of the pandemic. Also related to the pandemic, we did hear that some good news on the foster youth pandemic aid that went out. The IRS did recently provide some clarification and guidance on the fact that those funds will not be taxable as we're kind of here in the deep part of the tax season. So that clarification is helpful, and we're working to make sure folks are aware of that and clear on what that means. Also, in our adult and aging area for IHSS, just recently, the pandemic-related hero pay for our 27,000 IHSS providers went out, so that's also some good news. So, bottom line is, there's going to be a lot of things happening related to the pandemic and its current hopeful state of winding down and how it impacts our programs, and we'll obviously watch that closely and share the relevant and important information with all of you, so we can do our appropriate planning and get our appropriate guidance on this. And that's all I had.
That's a lot, Bob. Thank you so much. And I'm sorry to hear about the CalFresh. You know, that's so needed still. Thank you. Ignacio?
Yes, good afternoon. I wanted to give an update today on something that I haven't brought forward in a while, but I had it on my list of things to make sure to update the committee on. And it's on our call center that we have with Butte County. So we have a shared services agreement with Butte County to handle all of our customer service calls, which dates back to 2015. So we're coming up on the 7-year anniversary of that agreement. And it's been quite an exceptional arrangement and relationship between Butte County and Santa Clara County. I wanted to provide just a quick overview of some of the call center stats that we're seeing and that we've seen over the last year, just to give you all an idea as to the level of service that we're getting and that's being provided to our customers and families when they're calling our child support call center. Butte County is one of 4 large regional call centers for child support calls in the state of California. Butte takes calls for Santa Clara County, Contra Costa County, Stanislaus County, and Tehama, Lake, and Yuba counties. In a given month, they're handling about 13,000 calls a month for all of those counties combined. For Santa Clara County, our call volume is about 4,000 calls a month. So we're a significant portion of that. Of the 4,000 calls, their abandonment rate, which is the percentage of callers that hang up before their call is answered, is averaging 1% over the last year.
Wow.
Supervisor Chavez, you probably recall when this item went to the board, but when we were handling our own call center in Santa Clara County back in 2015, we were averaging an abandonment rate of 20%. So 1 out of every 5 calls was hanging up because we weren't able to get to them quick enough. So I think that says a lot about the level of service that we're fortunate to get from our partners up in Butte. The average wait time for a caller to have their call answered is less than a minute. And the average time on the phone to get their issue resolved is about 8 minutes. They continue to resolve about 90% of all calls upon first contact, with only about 10% of those calls being referred on to our child support caseworkers, our child support officers, for follow-up. So they continue to do an amazing job. We're very fortunate. Every month I receive a report from them around all of our call statistics, and they actually even break down the types of calls that they get, the most frequent types of calls, and those sorts of things. As you can imagine, the majority of the calls that they get are related to payment updates and payment status, followed by general case status inquiries. We continue to update all of our call protocols with them on an ongoing basis. We meet with their team in Butte County virtually to make sure we update them on any policy changes, procedural changes, or just general changes to our office. We're fortunate for this entire time we've had the agreement with them. This service has been provided free to our county, which was a tremendous cost savings. That was one of the reasons why we entered into this mutual agreement with them. One, that we knew was going to enhance the level of service for our customers. And two, we were able to take advantage of the state's push to create these large regional call centers in, quite frankly, lower cost of living areas throughout the state. So the relationship continues to flourish. And I just wanted to report out and let everyone know where we are. And I used to provide a more frequent update on our call center back when the transition first happened. And then I think we kind of got used to the level of service, and I hadn't done that in a while. So I thought I would do that today. With that, that concludes my verbal report, and I'm happy to answer any questions you may have.
Excellent. Thank you. Thanks for the update. Any questions?
No, that was totally new information and fascinating to me. Thanks, Ignacio.
You're welcome.
Thank you. We have one public speaker on this item. Do we take public comment on this item? Sorry, I don't know.
During verbal reports, I don't believe we do. Let me check the agenda because it's listed on there. One moment.
All right, by the time we do that, we'll already have a speaker. So go ahead and have the public
Okay.
speaker, and we'll know for the future. Thank
All
you.
right. Next speaker is Kathleen King. I'm unmuting you. You have 2 minutes to speak. Please go ahead.
Hi, this is Kathleen King from Healthier Kids Foundation. I actually wanted to speak on Bob Manicochi's presentation.
Go ahead, Kathleen.
Okay, I don't know if Bob's still on, but I just wanted to pass on. My organization just loves working with social services. They're responsive, they're professional, and they've just been so supportive of everything we've asked of them. And I really should put this in writing instead of doing it verbally, but I thought Bob was on, and so I could add that.
Oh,
okay,
he is.
Thanks.
He is on. Kathleen,
Okay.
we heard you.
Okay, thanks.
Thank you.
I'm having a little trouble with the raise hand. It's not working right all the time, so sorry about that. But yes, thanks, Bob. What a great organization. I wish they could come all work for us.
Thank you very much. And with that, we are adjourned until tomorrow. So I'll see you all then. Thanks all. Bye-bye.